Michaela, and I'm going to be your student nurse today. Before we begin, I would just like to check your ID band. Can you just give me your name and your date of birth?
Jacob Urias, February 8th, 2000.
All right, perfect. So today we're just going to be performing a basic exam. It'll just be a few questions and a few assessments throughout your body systems. And then I'd like to ensure you that you know we're going to provide the most privacy, confidentiality, and comfort that we can. And that if you have any questions, just feel free to ask me and we can stop at any time, okay? With that being said, do you have any questions before we begin?
Nope.
All right. Here's a drape. He's already wearing his gown. Okay. So have you been having any issues with your stay at the hospital?
Nope.
Have you had any stressors or anything?
Nope.
All good?
Yep.
Okay. Do you have any support, such as family or friends coming and visiting you?
Yes, I do.
Okay, that's good. I also noticed that you didn't have an allergy band on earlier. Do you have any allergies that we're unaware of?
No, I don't have any allergies.
Okay, perfect. Can you tell me what you had for breakfast this morning?
Scrambled eggs.
Okay, and I verified that with your chart, and that was correct. Can you also tell me what your first job was?
Hy-Vee.
Okay, and I confirmed that with your family, and that information was correct as well. Okay, can you tell me your name one more time?
Jacob Urias.
Jacob, can you tell me why you're here today?
Basic checkup.
And do you know where you're at?
Hospital.
And then can you tell me today's date, including the year?
April 9th, 2020.
All right, good. So after speaking with you, I can tell that your speech is normal and adequate. Do you feel that you have any issues with your speech that you would like to address today?
Nope.
Okay. Do you have any difficulties that you feel are affecting your activities of daily living, such as brushing your teeth, getting dressed, or taking a shower?
Nope.
Okay. Now I'm going to ask you a few questions associated with your systems. So can you tell me the last time you urinated?
2 hours ago.
Okay, can you tell me the color and consistency of it?
Slightly yellow and clear.
Okay. And then, did it have a strong odor?
Nope.
Okay, great. The next question I'm going to ask you is, when was your last bowel movement?
2 hours ago.
Do you remember the consistency of it?
Formed and brown.
Okay. And then, do you know your regular bowel movement schedule?
Twice a day.
Okay, so have you been having any irregular bowel movements?
Nope.
All right, that's great. So if you could just lay down for me, we'll begin the abdominal assessment. I'm going to put this underneath your legs. Okay. I'm just going to unbutton this. Okay. Looking at your stomach, I can tell that it is flat and non-distended. It is a whitish pale color throughout with no striae or lesions. And now I'm just going to auscultate in each quadrant for 15 seconds. Alrighty, everything sounds normal. Now that I've auscultated, I'm going to palpate in each quadrant. If you could just let me know if anything hurts or if there's any pain or tenderness. Any pain or tenderness?
Nope.
Alrighty, so everything seems normal. Now I'm going to have you sit back up and we're going to do the cardiac exam. Okay. And I'm going to have you I'm going to have you lean back a little bit. Okay. And I'm just going to open this up a little bit, trying to expose you as little as possible. I'm just going to listen. Okay, and I'm gonna listen one more time with the other side of my stethoscope. Alright, and everything sounds normal. Now, have you had a cough?
Nope.
Alright, so you've had no secretions or sputum?
Nope.
Awesome. So now I'm going to begin with the respiratory assessment. So every time that I place my stethoscope on your chest, if you could just take a deep breath for me, and then every time you feel it again, just continue to take that deep breath. Alright, and then if I could just have you sit up for me really quick, and then turn your gown around for me. If you could just turn your gown around for me. We're just gonna unbutton it, and then you could just stand up and then put it on the other way. And then here's the cover. Okay, and I'm just gonna, every time you feel my stethoscope again, if you could just take a deep breath. Alright, then if you would like to sit up and then move it back to the front side. Alright, and then here's your drape. Okay. Now we have finished the abdominal, respiratory, and cardiac assessment. And one last thing I'd like to address about your respiratory assessment was that when you were breathing, I noticed that your breaths were regular, they were deep, normal, and respirations were normal as well. So the next thing we're going to go to is your eyes. So the first thing I'm going to do is I'm going to check the size of your pupils, and they are about a 4 bilaterally. And now I'm just going to do some eye tests. So I'm just going to go like this, flashlight into your eye, and then do it to the other eye as well. Okay. And then if you could just look at the bridge of my nose and then just follow the pin in. Alright, great. So your eyes are equal, round, and reactive to light and accommodation. And while I have my pen light out, I'm going to check your mucous membranes and see if they're moist and pink, which they are. Great. And then I'm also going to do a skin Tuger test. Great. Okay, the next thing I'm going to do is I'm just going to assess your arms and legs for edema and color. I see no edema, no lesions or striae, and I can tell that your skin is a whitish pink throughout, which is consistent with the rest of your body. And I'm also going to do the same for your legs. Your legs are show no signs of edema. They are palish pink, palish white pink throughout, with no striae or lesions as well, which is consistent with the rest of your body. So while I'm down here, I'm just going to do your capillary refill. Okay, and I'm also going to feel for a pulse here. Great. Okay, so what I'm going to have to do is put your hands on my feet and just push down like if you were in a car. Good job. Okay, now I'm just going to pull on your legs. Don't let me pull. I'm going to push. Don't let me push. All right. Good job. And now I'm going to come back up here. I'm going to do the same things with your hands. So if you could just not let me pull, not let me push. If you can just move them around, show me that you have good movement. Great. Okay, now I'm going to feel for your radial pulse. Alrighty. And do capillary refill check. Sorry. And the last thing I'm going to do is a sensation test. Okay. And I'm just going to have you close your eyes for me, and whenever you feel me touch you with the cotton ball, if you could just let me know that you felt it.
Yep. 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 Yep.
Okay. And with that, that concludes our basic exam. Is there any questions you have for me today or anything you'd like to discuss?
Nope.
All right, well, stay healthy and I'll see you again soon.